If you are a musician interested in hearing protection, or concerned about hearing loss, or maybe experiencing tinnitus for the first time, or even going through a tinnitus spike right now, I think you'll find the information in the following interview not only very informative, but also very reassuring. Last night I had the opportunity to interview Mr. Rob Shepherd, who is not only a leading consultant audiologist in the UK, but also someone who has a keen interest in helping musicians. Some of the topics we covered including hearing loss, ear protection, how earplugs actually attenuate, and also towards the end of the interview, Mr. Shepherd spoke directly to musicians who might be going through tinnitus for the first time or going through a spike in their tinnitus. Again, I think you'll find the information not only very informative, but also extremely reassuring. It's certainly information that I would have loved to have had 6 years ago when I was going through a really bad period with my tinnitus, and I'm a musician, so it's sort of close to home for me. I started off the session by asking Rob to introduce himself and to give us a little understanding of his area of expertise.
Hi, Jack. So my name is Rob Shepherd. I'm a consultant clinical audiologist, which means for the last 37 years, I have treated and diagnosed or assisted with the diagnosis. I've tested countless individuals with auditory conditions. I sit on the audiological steering group for the British Association for Performing Arts Medicine. I'm audiologist to the Royal College of Music. I advise various other performance orientated organizations. I sit on some national and international committees that create the regulatory standards when it comes to the production and supply of hearing protection. And what else do I do? I'm a member of the World Health Organization's Make Listening Safe working group.
My first question, I want to dive straight into it because I got so much to ask you.
Okay.
So let's start from the beginning. I'm a musician, whether professional, amateur, and I'm starting to experience some difficulties with my ears. I'm getting some heavy ears, some feeling of heaviness, maybe tinnitus, and I'm getting concerned. And I come to you. What are some of the initial procedures that you go through with a musician in that situation?
So I would undertake normal investigations to exclude any treatable pathologies, make sure you've got no wax blocking your ears, make sure you haven't got an ear infection, and then we would undertake some audiological tests to measure the acuity or the integrity of your hearing. And we do the traditional hearing test, the audiogram, to measure your thresholds to see whether your hearing was normal. But we'd also, if indicated, undertake otoacoustic emissions, which would measure the integrity of the tiny little hair cells in the inner ear, because you can damage or injure those hair cells and a large proportion of those hair cells long before the audiogram will show up any hearing loss. So we could indicate that there's a reduction in performance or function of the inner ear, even if your hearing was normal.
So that's an interesting point, Rob, because I'm a bit confused about this. Because last time I went to see the ENT, the lady told me I've got hearing like a dog. And I have very bad tinnitus. So my question is, if I have tinnitus, does that mean that there is some damage to my hearing at some level?
Tinnitus can be caused by lots of different factors. And it's really common for musicians, because of the world that they live in, that they have been exposed to loud sounds. Yeah. And those loud sounds will affect the function of those little hair cells that I mentioned a moment ago. And they're one of the first things to be impacted by exposure to loud sound and music. So that it's quite possible that you will lose a proportion of those outer hair cells, yet still have very good measurable hearing on the traditional audiogram. So that's why the person you've seen says you've got really good hearing, but maybe you're not hearing quite so well in background noise. Maybe you're having problems following conversation in a noisy pub. Maybe you've got tinnitus. Maybe you've got some other underlying symptoms, which can be explained by those other tests that we talked about. So it's important that when we're assessing musicians, that we fully assess them and do more than just provide that traditional audiogram.
Yeah, because that's something that I was sort of thinking about, because when I'm sat in that cubicle and I'm pressing that little button,
Yeah.
and because I feel like I've got good hearing, and it's sort of it's a bit confusing because I'm pressing the button and I'm thinking to myself, surely there must be more advanced methods to do this, because it seems a bit basic to just press that button every time I hear a peep. And like I say, I feel like I've got really good hearing, but at the same time I've got quite bad tinnitus. So it's an interesting thing that there are more tests and sort of more in-depth tests that you can be done.
Yeah, and it's important that you do fully investigate personally, because I see lots of people who, like yourself, have been told you've got normal hearing, therefore you haven't been exposed to any hazardous sound, therefore the reason for your tinnitus is idiopathic. We don't understand it. And I think when you don't fully explain to someone why they might be experiencing tinnitus, and you don't give them that understanding, that perpetuates the unknown, it perpetuates the fear, and therefore increases a person's awareness of that symptom. So it's really important and really useful that when we're treating people with tinnitus, as much as possible, we can give them an explanation of why that symptom is there.
Yeah. So just before we go any further, I want to take it to a worst case scenario, and then we'll swing it back to a more positive ending at the end. Okay. Just so that musicians or anybody watching this understands the importance of what we're talking about, could you talk to us a little bit about the secondary health implications that hearing loss can sort of give rise to?
Okay, yeah, so if we forget for the moment the inalienable fact that exposure to loud sound will cause hearing loss and tinnitus, there are, as you say, secondary considerations, and they are often unknown or even or not talked about. So it's been, there's lots of research and papers published that support what we in audiology have suspected for some time, that the presence of hearing loss will increase the risk of other conditions. Hearing loss will increase the risk of dementia. So somebody experiencing even a mild hearing loss, you're doubling the risk of suffering from dementia. And a severe hearing loss, you're 5 times more likely to suffer dementia. So it's really important that when you're considering exposure to sound and protecting yourself from exposure to sound, it's not just protection against hearing loss, it's other conditions as well. Exposure to noise can also cause cardiovascular illness. It can cause hypertension, increased blood pressure. There is an increased risk of stroke and arrhythmia. So there's a whole wide range of conditions that can be caused by exposure to loud sound.
This is, I think it's wonderful that you say this, Rob, because I get emotional when I hear this stuff, because I feel that hearing health doesn't have enough sort of exposure. It doesn't have enough, it's not given enough attention, I don't think, especially in the music world, because we consider it to be rock and roll, to turn the amp up to 11. And even though it doesn't go to 11, the idea of playing it loud. And when I hear all this stuff, I'm like, gosh, more people need to know about this stuff. Yes, let's move on, because otherwise I start waffling, because I feel really passionate.
I completely agree, and I waffle quite a lot as well. I think we get comfortable. I think we get complacent, and we don't understand how much influence exposure to sound can have on our general health and well-being.
Yeah. Is it right to think that if hearing loss is addressed and rectified through hearing apparatus, hearing aids, that we essentially reduce the risk of getting dementia, meaning that it doesn't necessarily mean a person's going to get dementia if they address the hearing loss?
Yeah, I mean, it's not fully understood the link between hearing loss and dementia is yet. I mean, the studies are quite robust in demonstrating there is a link. And we think that if as soon as possible, we can, as you say, address any degree of hearing loss with some sort of hearing technology, then that's going to significantly reduce that risk of further conditions down the road.
Right.
So yeah, the quicker you can help your hearing loss, the more you're going to reduce that risk.
Brilliant. Rob, one of the #1 questions that I get asked virtually every week by musicians are what earplugs I use, what do I recommend? And my answer is always the same. I rely on my custom-made silicone earplugs that are -30 and -36. The -36 are essentially a lump of silicon molded to my ear. Could you talk to us a little bit about the mathematics of how earplugs work and generally earplug protection? So my first question would be, if I'm in an environment of 86 dB, for example, my Apple Watch is telling me on the sound meter that I'm in 86 dB, rehearsing, recording, whatever, and I've got -25 dB earplugs. Does that mean mathematically that I've got essentially 61 dB coming into my head, and I can therefore think to myself, okay, I've got 61 dB and I can sort of deal with that for this amount of time? Is that how it works on a mathematical level?
Well, yeah. I mean, I think the way that hearing protection generally works is to block the ear, so sound cannot enter the ear. I mean, we still get sound vibrating through the bone, so there's only a certain amount of sound you can reduce. But yes, if your ears are effectively blocked up, then you will be getting a certain amount of reduction. But sometimes it's important to remember that the figures that you see on a box of PPE, so when you buy the earplugs and you look at that SNR figure, that single number rating, that figure was created by limited measurements in a laboratory. And the real world attenuation that you may be getting may be a long way from that. So ideally, the hearing protection that you're provided, and especially the custom molded hearing protection that you're provided, should be verified when it's supplied to you, so that you know actually what real world protection you're getting, and not just necessarily rely on that figure printed on the box, because it may well be they're not the same.
I think this stuff is important, Rob, and it really gets me, because we're dealing with real world situations. You've got musicians who are putting their hearing on the line night after night, thinking that they have a certain amount of protection in their ears, and that might not necessarily be the case. And I think this is really important stuff. I mean, it's a new information to me to know that if it says something on the box, it might not necessarily be exactly that. That's new information. I was under the impression that if it's -25, it's -25. So I think this is so important that musicians know about this. And by the way, how do they verify? How does that actually work? Is it like a sound test with them in?
So the way that they're assessed in the laboratory, you'll have 16 individuals, and they will have an audiogram done, the basic hearing test, and then they'll put the earplugs in, and they'll have that test done again. And the average out of those 16 people is roughly what the measurements are for the SNR figure.
So when someone gets their earplugs verified for their own personal use, is that how they do it? That must be how they do it as well, is it?
Well, no, there's lots and lots of methods, and you can verify the physical fit either by a pressure test or an acoustic test.
Okay. Or
you could do an audiometric-like test to give you the PAR, the personal attenuation rating. So there are various methods, and the UK Hearing Conservation Association has just published some information on fit test methods. So if anyone's interested in that, go to the UK HCA website and find out more about it, because it's now actually becoming a requirement as part of the standards, the regulatory standards we've created, that all custom molded hearing protection must be verified when provided.
Yeah, because I mean, to me, this is essential. Like if I'm going out gigging, which is, for me is a real world situation, I need to know what I'm at. I need to know where I'm at with my ears. And I think it's absolutely essential. And I think this is great information, even for me to know this, because I now need to get my earplugs verified, because I need to know what I'm dealing with, because then I can sort of, just to deal with my own sort of anxieties or sort of concerns when I'm on stage, because then I can know what I'm doing. By the way, while we're on the subject, could you talk to us a little bit about length of time? Is it to do with the capillary hairs in the ear that can only deal with that much vibration for so long? How does it work?
Well, so you've got tiny stereocilia, those little hair cells again that we mentioned a moment ago. I think of them rather like blades of grass. So if someone walks on them gently, once, they will bend and then they'll recover. But if someone walks on them repeatedly, so if you're exposed to sound for a prolonged period of time, or again and again and again, or if someone stamps on them with big boots, so it's a really loud noise, that grass is damaged and irreversibly injured, so that it can't work the same way as it did before.
Yeah.
So yeah, it could be a prolonged exposure, or it could be a single exposure to very loud sound, but the effect is the same. Those hair cells are destroyed or become less functional, and so the performance of the inner ear is reduced.
Yeah, that's a really good way. I can visualize that, actually. That's a good way of doing it, because I can visualize it that way. So just for my own sort of understanding, sometimes I'm exposed to noises for, maybe around 85 dB. And they might be for like 5 seconds. And sometimes, because I live in this world of being conscious of sound, I think to myself, oh, was it too loud? What have I done some damage? So following that sort of logic, if something's around 85 dB and it only lasts for a very short period of time, like 5 seconds, something like that, I shouldn't maybe be too concerned about it. Is that right?
No, 85 decibels. My voice at the moment is about 70 plus decibels. So 85 decibels for a short period of time isn't going to be hazardous. But 85 decibels for days on end, for 8 hours a day, may well be.
Yeah. Okay. I think that's important, because, as someone that lives in that world, I'm always thinking, oh, was that too loud? Was that plate that fell on the floor too loud? So, okay. So following that logic, I shouldn't really be concerned about that sort of stuff. And I know that other people are concerned as well, because they, was that car horn too loud? That sort of thing. It's something that plays on your mind when you have tinnitus, like I do,
Yeah, I think people with tinnitus, and generally people who are very aware of sound, which musicians are trained to be, they can become hypervigilant to sound.
Yeah.
So a normally loud sound will become, very obvious to them. And there are certain conditions where that tolerance to normally loud sound reduces, hyperacusis. So yes, I wouldn't be overly concerned about exposure to moderately loud sound.
Yeah.
But be aware of the sound around you, and the more that you can avoid prolonged exposure to loud sound, the better it will be.
Yeah, brilliant. I mean, even if the viewers don't find that interesting, I find it very, very interesting and comforting. I wanted to ask you a more generalized, bigger picture question. And I'd be interested in your answer. Do you think governmental bodies and the World Health Organization, do you think they have, and do you think they are doing enough to get people educated? Because to me, it seems like a lack of awareness amongst the people, and it's not their fault. It's just because it seems to me that ear is sort of bottom of the pile when it comes to sharing this information, when really it's really important. Do you think there's enough being done to get this information to people?
No, there's never not. I'm a strong advocate of increasing awareness, and I think that the World Health Organization are doing a great job. The Make Listening Safe working group have some great initiatives on improving awareness. I'm always talking to people who are positioned to better inform the general public, but there's always more that can be done.
Yeah.
And I think it's important that we don't become complacent in the information we give people. And it's important that we connect and we engage people, especially musicians. Often we point our fingers at musicians saying, don't expose yourselves to any sound more than this, and buy a set of earplugs and have a hearing test. But that's not, I don't think that's going to achieve what we want to achieve. We want to engage, we want to connect with musicians, we want to motivate them so that they're fully aware, fully informed, and they can maybe make a behavioural change and embrace their hearing protection and be vigilant in wearing their hearing protection, because they've been fully made aware of the implications of the sound that they're exposing themselves to. And I think sometimes just criticising musicians for not embracing control measures isn't going to be productive. So yeah, if we can make people fully aware of all the implications, all the test procedures available to them, the information on hearing protection, and the risk of exposing themselves to certain levels of music, it can only be a good thing, because the more I'm an advocate for people having an informed choice of their healthcare. So if they're fully informed, they can make the right decisions for themselves.
Yeah. Can I ask you about stress? I find that, and I know that a lot of people I've spoken to find that when they're stressed, maybe when they're tired, all of a sudden perception of sound goes up. How does that work?
So when you say perception of sound, you mean their tinnitus increases? Yeah. So when we're stressed, when we're anxious, when we're angry, our brain kicks in their fight or flight mechanism more. So it releases certain hormones, and we become much more aware of the sounds around us. So that what might have been an unobtrusive, quiet noise in the background, suddenly we focus on it. It causes increased anxiety. It causes increased stress. That then makes the primal part of our brain work overtime. There might be a saber-toothed tiger in the bushes. There's something that we need to worry about. So our brain then works even harder, and it makes us even more aware of the sound, which then causes more stress. And it's a vicious cycle. So tinnitus loves stress. It loves anxiety. It loves irritation and anger. And the more that we can recognize that anxiety and stress will influence our perception of our tinnitus, the more control we can have over it.
Yeah, I find that whole sort of balance, or the whole dance between stress and the mind and tinnitus, is fascinating, really, because, when I'm alone in a room and if I'm happy, I go, yeah, the tinnitus is there. But if I'm alone in a room and I'm stressed, it's all of a sudden, it sort of creeps up a bit more. It becomes a bit more annoying. So yeah, it's fascinating.
Yeah, I mean, it's very much down to perception. If we perceive something as unknown, again, going back to fully investigating why the people had the tinnitus in the first place, if we perceive something as hazardous or dangerous or harmful, our brains are hardwired to escalate that and make us fully aware of it. Whereas if we think of something as unimportant, benign, then we will ignore it.
Yeah. I think that's really nice to know. It's reassuring, actually. I've got a couple more questions for you, Rob. I work with a lot of musicians, and I'm not the earplug police. I don't even often mention the whole tinnitus thing that I do with Help My Tinnitus. I often don't even talk about it because I don't want to become the earplug police. But I'm very aware of it, and I'm very aware of other musicians talking about this. So I might be backstage, and we'll be talking about a recording session or something, and it will come up, and maybe they know about these videos that I do, and they'll say, "Oh yeah, I saw that video," and they'll say to me often, Rob, they'll say, "Yeah, I did a recording session about 2 weeks ago, and I came away with heavy ears or a tinnitus. I had tinnitus for a couple of days, but then it went away." My question is this: what would you say to musicians who are occasionally experiencing tinnitus, occasionally getting that heavy feeling on their ears, like their ears are being really taxed, but they're still not getting chronic tinnitus or constant tone? What would you say to them?
Well, again, it's about making them aware, making them informed of the implications of only wearing their hearing protection on occasion. Some people will wear it for maybe performance, but when they're rehearsing, they won't. It's protecting and conserving your health in all environments. So whether it's listening to music while you're sitting on the tube, whether it's when you're rehearsing, whether it's when you're performing, if people are aware of the potential hazard, if they're informed, they can then make the right decision. But again, I think it's important that we talk about conserving health and conserving hearing health, but we also talk about conserving music, because that's what's really important to musicians. And if we just lecture them on protecting health, then I think you're missing that opportunity to engage. And I think you're losing the opportunity to make that behavioral change. So if you can demonstrate to a musician that it's important for the longevity of their career, it's important for their performances and maintaining their connection to music, and the two are not mutually exclusive. Wearing good quality, appropriate level hearing protection shouldn't stop them with their performances. So I think, again, making people fully informed and helping them conserve music as well as conserve hearing is really important.
Yeah, I think that's a brilliant point, actually, Rob, because if I know being a musician myself, if someone comes at me with, oh, you've got to do this, you've got to do that, being sort of the way we are, often we sort of go, oh, I do my own thing. Whereas if you come at the way you say it, it's about actually preserving your career. It's about you being able to do this in 10, 15, 20 years. That's a really good angle to take, I think, actually. Okay, one last question for you, Rob. I know for a fact there's going to be musicians watching this video in the future, and they're going to be alone in their studio, in their bedroom. They're going to be distressed. They're going to be emotional. They're going to be concerned about their career because they're going through a spike in their tinnitus, or they've experienced tinnitus for the very first time. If you could talk to them on a one-to-one level, what would you say to those musicians who are sort of going through that emotional period of having a spike or experiencing tinnitus for the first time?
Well, what I'd like to see is that before they reach that level, they've been given the right support and care, so that when musicians do experience tinnitus, and it's a very, very common symptom with musicians, but they're already conditioned to be fearful of it. So if at a much earlier stage they realize the true nature of tinnitus, that it's very common, but it's likely to become better and less intrusive, and it shouldn't really impact their longevity of their career and their ability to perform their music. I would inform people at that stage, if they do suffering from it, that it will get better with the right support and the right assessment by professionals who have an experience and an empathy for musicians with tinnitus. Then there's no reason why it can't be lived with, or depending on what the underlying conditions are, sometimes we're able to inhibit it. But I think, again, whilst people are fearful of it and stressed by it and worried by it, it will become more obvious to them. But if they've already been conditioned to realise that tinnitus doesn't have to be the end of anything, it is in fact just a very quiet sound in the background. And if we recognise it as such, it shouldn't interfere too much with our lives.
That's
easy for me to say. I know, sorry, Jack. It's easy for me to say, because it can become all, people can focus on it and it becomes all powerful. But the more power you give it, the more it will take. The more you recognise it for what it really is, the more you can gain some control back.
I think this is really beautiful, Rob. And I mean, it sort of touches me when I hear this, because I've sort of been through some pretty big ups and downs of my tinnitus. And, when I sort of first started researching what I could do 6 years ago, it gets pretty desperate. It gets pretty lonely, and it gets pretty desperate. And you can come across ENTs that don't understand the position that musicians find themselves in the situation. So it's absolutely wonderful to find someone like yourself that genuinely has an expertise in their field, but also an understanding of what it might be like for musicians. You have empathy, and you come across the other side to where, to us musicians, and I think it's wonderful. I think it's very nice to hear that. And I'm sure that any musicians watching this are going to get great benefit and comfort from that, because what you've said is essentially something very reassuring for me too, because I sort of I sort of go through it as well. So I think it's wonderful information, Rob, and I'm so happy that we were able to do this. I appreciate so much your time. You've been very generous with your time, and I think it's wonderful information that I can share now, and I really, really appreciate it. I'm going to just to sort of bring a conclusion to the video, I'm going to have a page on my website, Help My Tinnitus, where I'm going to share the links that you shared with me. Could you talk very briefly about those links, what they are?
Okay, so part of my work with the Healthy Conservatoires Network and the Royal College of Music was to create some videos to help inform anybody who's interested on how audiology can support performers. Also, it refers to guidelines, the best practice guidelines for conserving auditory health for performers in the UK, and it puts those guidelines in maybe a more easily understood format with these videos. It also talks about the health and safety noise at work regulations in relation to the entertainment industry. And also there's another one about how exposure to music can injure or damage our auditory system. So they're all there, and it provides some really useful, accessible information for musicians.
Brilliant, brilliant. So those are going to be on my website. It's going to be a page called Useful Links, and I will also have a description of Rob and those links included. So one final question, Rob: Saturday night record and Sunday morning record.
That's hard.
I know, it's put you on the spot.
I'm asleep at Saturday night, so I don't actually. My favourite music, I love classical.
Yeah.
I enjoy. My favourite piece is Rachmaninoff's Rhapsody and the theme of Paganini. You know, that's a very emotional record for me, and I love listening to that. And my favourite Saturday night, well, I'm a child of the 80s, so I love Level 42.
Brilliant.
So,
oh man, amazing bass player.
I enjoy Level 40. Yeah.
Yeah.
So
I heard that he insured his hands for like £1 million or something like that.
yeah. I've seen Mark King play a few times, and it's a joy to behold.
Yeah, he's brilliant. He's brilliant. Great songwriter too. Rob, thank you so much for your time. Thank you so much. I genuinely mean that. Thank you.
It's a pleasure, Jack, and you know where I am if you need me.
Brilliant. Thanks.